Welcome again to a special episode of the Only Healthcare podcast, coming to you live from the Nicholas Hall North American Conference. This second panel talks about some of the consumer aspects related to the new FDA ACNU rules. So please enjoy this episode. Welcome back to part two of our special episode of the Only Healthcare podcast, live from the 2025 Nicholas Hall North American Conference. This episode brings us to the topic of self-efficacy in healthcare, looking at the consumer self-efficacy and the promise of ACNU in particular. Non-prescription access offers a uniquely broad solution for many therapeutic categories. For one example, we're going to drill down in this particular episode on diabetes management. In this discussion, we will have a set of experts from life sciences with experience, particularly in the diabetes category. Mary Alice again joins me as my co-host.
Thanks,
Mary
Randy.
Alice, welcome again.
Thank you again. And I will have the pleasure of introducing Joe McGovern, just to Randy's left here. Joe is well-versed in public health matters and the crisis of diabetes, but even more importantly, he's an absolute pioneer, maybe one of the foremost experts in Rx to OTC switch, and has been a leading advocate for access transformation and a real contributor to the additional conditions rule. Next to Joe is Teresa DeSantis, and I know a lot of folks in the room know all of these guys. Teresa, of course, has worked with many folks here and is a CHC and switch veteran as well, and an expert marketer who we want to hear from today to sort of, get that marketer insight about what does ACNU really mean. And then finally, to my right here is Bob Barron. Bob has a pretty deep experience in the diabetes space, having worked very recently for Sanofi on their diabetes GPU, but also in his professional career had stints in CHC, was a part of the switch of Zyrtec, first on the Pfizer side, then on the J&J side. So welcome to all of you, and thank you for coming.
Thank you.
So to kick off this episode, Joe, can you set the table on the crisis of diabetes?
Well, Randy, we've talked about obesity as a population risk factor in this country, and consequently diabetes knows no bounds. If we look at the numbers with diabetes are a public health crisis today. 38.4 million have diabetes and nearly 9 million are undiagnosed. The undiagnosed are not the only untreated. We should also be concerned about 46% of those on insulin who are not adhering to their treatment. People with diabetes also have comorbidities and medical costs that are 2.6 times higher, with 1 in 4 healthcare dollars spent going towards diabetes care. And that's not a static situation. If that wasn't bad enough, the CDC have estimated that by 2030, around 1 in 5 adults, 20% will have diabetes. In other words, about 68 million people could be living with diabetes by then, a more than 20 million increase this decade. So the population is growing dramatically, but the numbers of doctors are not growing dramatically. In fact, they're actually decreasing. The people with diabetes and the challenge of undertreatment is with us, and it's getting worse.
So, Bob, you're a veteran of the industry.
I am.
Sorry.
And talking with clinicians in the diabetes space, can you tell us a little bit about the scope of the problem from your experience and what's frustrating providers?
So I spent 10 years in the diabetes therapeutic area, and endocrinologists that I spoke to, and most physicians in a number of different disease states all complained about adherence and compliance with their patients, usually leading to progression of the disease. And with diabetes, you have blindness, you have kidney failure. There's a lot of bad things that happen if you don't control your diabetes. Doctors want patients to have self-efficacy, and they want to be able to support their patients when they leave the office. The ACNU ruling is now giving clinicians, an opportunity to have the patients followed up once they leave their office.
Mm-hmm. Teresa, how about you? You're listening to this through the marketer lens. What do you think this idea of some future consumer self-efficacy in an area like a chronic state like diabetes or others, what does that really mean, and how does it present itself potentially as an opportunity for a new generation of thinking?
Well, as marketers, we're always driven by the goal of trying to get a direct and meaningful relationship with our consumers. So if I were a marketer today and had the opportunity to have a program that could have an ACNU associated with it, I would think that I would finally have the opportunity to not only connect with consumers, but to have an ongoing connection with them and really help them through their healthcare journey. When you look back at, we're all very familiar, and we just heard in the previous podcast about the effort to switch Mevacor to OTC as a statin for cholesterol. But if you take a look at what was required for these guys to be able to produce the amount of material, think about the resources and time within an organization to develop and test these kinds of consumer programs so that they could provide what was going to be required from a consumer education perspective. That must have cost them $1 gazillion, but the size of the program was so big, I'm guaranteed that it was a positive P at the end. But the reality was that all of these materials they were optional, and they were really hard to deliver to the consumer. So as the FDA was considering this program, they couldn't rely on this material to get into the consumer's hands. What's different now is with digital care interventions, or ACNU, the brands can provide this material personalized to consumers instantly and interactively, so that it's, from my perspective, a real game changer in the way that we can approach consumers. ACNU can truly become a brand companion, giving the consumer what they need, when they need it, and it becomes more than just about the medicine. It becomes empowering them to stay on this journey. And that's a tremendous opportunity as a marketer, to be able to say that we took a consumer not only to the right treatment, but to stayed with them through their treatment and kept them on it.
Mm-hmm. So we've been hearing a lot about the promise of ACNU, ACNU. The question inevitably leads to, so what's the value prop? What's the dollars and cents that's behind some of these things? So I'm going to turn to Joe and say, so does ACNU require a lot of extra work and expense of the sponsor in developing this? And then maybe that's increasing the costs, or we would never see a product go through ACNU.
Well, it's not the intention of FDA to make it to make additional conditions burdensome. And frankly, it's not the intention of our team who've worked on this to make it burdensome. We've worked very hard to make it easy for sponsors. Relatively easy. Switch is never easy, but relatively easy. The agency expects more of a standard operating procedure for ACNU interventions. And we've had many discussions with FDA, and my team has led the assembly of a system of care coordination with capabilities for ACNU. This is from trial right through to operationalization. Sponsors can plug in. This integrated system that I'm talking about, we can talk more about it individually later, provides a set of integrated services in tandem to deliver a consumer care intervention that meets FDA's quality standards. And that is a springboard to what Teresa's talking about, which is one-to-one consumer engagement. The standard operating procedure for ACNU development has 5 key steps. So 1, write a label and identify with data what Dr. Michelle calls at FDA the pain points. She means the pain points for selection or use. Number 2, engineer the ACNU algorithm to address the pain points that are in the label. Script the automated care intervention that will be regulated as labeling by FDA. Develop objective data queries to verify safety for the individual consumer at an individual level. take the plan to FDA, and work towards NDA approval with a high PTRS, a high percentage of technical and regulatory success. And because your plan is based on gold standard practice and delivered through the trusted healthcare system, you do have a high chance of success.
Well, that's really interesting. So we can actually simplify some of this activity with a simple SOP from the manufacturer, supplier, supply chain system that we have in this country, since we're in the U.S. I'm going to turn to Bob, though, for diabetes. I'm imagining we need some kind of an approach that is around this shared care concept that FDA was pushing out there.
I agree, Randy. The FDA has made room for making that point. For some drug products that require an initial prescription, the product could be made available as a non-prescription product with the condition of safe use for the purpose of product refills. This provides a pathway for treatment, which according to published guidelines, you would start with diet and lifestyle modifications, maybe add metformin. We talked a lot about GLPs today, and other products that are available. And then ultimately, when your pancreas starts to make less insulin or no insulin, moving on to insulin. So that, there's big place for insulin in this country. So each of these products that are out there, can find a pathway through ACNU.
It's interesting. Diabetes is interesting because it does sort of give us all of those different dimensions. An actual pill, very familiar with that in the consumer healthcare space, a pill in a bottle. That's the metformin, long-term body of evidence for metformin. And Chelsea, if you can just go back to those guidelines one more time. Sort of that's the starting point. And then the GLP-1s, as we've discussed and have been discussed, and frankly, the GLP-1s, we had a speaker from the Cato Institute last year at this meeting whose topic was OTC Ozempic. And, there are many arguments for it. Again, none of this is a blunt instrument. All of it is the fine details of what portion of that utilization should be. But insulin in particular, which is stage 3, but still, as Joe mentioned, we have so many people who are not stabilized on their insulin therapy. And basically at that point in diabetes, your pancreas is not creating enough insulin. So you really have to have it. People run out, they, have an unbelievable experience at the pharmacy where last month it was $50 and this month it's $350. And, that's not something that consumers can tolerate. So we've looked a lot at insulin. We actually have OTC insulin, human insulin, but it's really not the standard of care, right?
Right.
Right.
It's not.
So to get the standard of care to where at least we have already, insulin, and pharmacies don't really promote it or stock it. Nobody talks about it. It's meant to be there for crisis situations. So I just think it's sort of an interesting disease state, really a risk factor state to ponder and think about in terms of what opportunities it presents and what long-term opportunities, right? If somebody stepped into this, they've got a whole continuum of products.
Well, you've got the diabetes category is massive. It's huge, but there is so much unmet need within it. We talked about the drugs of choice. But a third of the patients on metformin don't stop taking it after the first year. And even those who remain on it, they're not adherent for the long term. And you look at the new drugs like the GLP-1s, those are great, but 50% of the people who take them don't even make it through a year. Right. There's just side effects that need to be managed, and patients need to be talked through how to deal with those. And that's the problem with them. And even adults with type 2 diabetes, I think 40% of the people who are on insulin discontinue it after they start their therapy. Those kinds of things are they're hard to hear and know that there could be a solution for them. So you think about it from a marketer's perspective, what if we could get involved with them before they drop off? What if we, knowing as much as we know about how these consumers use these products and what they suffer from and why they become non-adherent, what if we were there for the query and the answer and the way forward, or to help direct them so that we truly become companion through this whole thing? I think that the digital care intervention is the key to this whole thing, is really being able to understand our consumers. We know that we're smart about figuring that out. We know that we can divide and conquer. We know what their trigger points are and how to communicate with them in a way that's motivating enough to keep them going. We just aren't there with them every day, which is where we need to be.
Joe, do you think that that's a thinking FDA had? I mean, FDA's got a lot of experience with the CHC industry, and they've watched how expertly consumers can be engaged. It's a completely different paradigm from the amber bottles and the RX drugs. So, I mean, are they, I don't know, listening to this, I feel like maybe FDA is counting on us to do exactly what you're describing.
I think they are, because last week at the RSQ, the leadership, particularly Teresa Michelle, encouraged the industry to think that what was impossible is now possible, and to think broadly about the opportunities that the ACNU rule opens up.
Well, it's kind of interesting listening to what is coming out of this part of the world of healthcare, the consumer side, and the products that are being thought about and being developed. From the employer perspective and the other managed care payers, the health insurers and so forth, they're really struggling with costs coming out of the pandemic. We're seeing double-digit increases that are very significant this year going into 2026, which is resulting in a lot of these plan changes that are being talked about in all the other conferences that I go to. And this whole issue around productivity impacts by the employees of these plans, the impact of diabetes itself, which we've been talking about, and the problems that the employees who are the plan members, and they're the patients, they're the consumers, even though they know they should be taking it, they're not taking it, or they're not using it. And that's been well established for decades. That's not anything new. But getting more people into treatment and staying on treatment is really the game changer that we're really talking about here today, right? How do we get that to them in an easier, more simpler fashion? Joe?
Well, as I said last week, Dr. Michelle said things like, the rule opens up the possibility of introducing a drug, a non-prescription straight away. It opens up the opportunity to introduce a new drug, prescription and non-prescription at the same time, straight away. And don't think that's competition, because these are different populations. And obviously, it opens up a raft of categories that haven't been possible in the past, but now are possible. And we've thought a lot about this, and if you want to think more broadly, just please talk to us.
So I'm going to bring up a couple questions now. I'll start with Teresa, and Joe can add on to that.
Yep.
So the question is, how does digital care marketing complement ACNU care intervention?
Well, the consumer is given instructions when they leave the doctor's office, and they understand what they're supposed to do. But those, you kind of forget about those things after time goes on. The digital format being able to be accessed by the consumer in those moments of need and those reminders to take their medicines helps with the compliance of these products in ways that have never been known before.
Now, if the consumer opts in, and this is a discussion we've had directly with FDA, if the consumer opts in for company support, further support, you know who they are. You make a direct relationship with them. You add value so great that if there ever is private label, they'll be not interested in private label. They're getting so much value from your care, your day-to-day support, and the drug itself.
Well, you've got 3 years to do it. So if we are smart as we believe that we are as marketers, we've got 3 years to be able to make the label.
Yeah, the other thing, that direct relationship means that you generate insights every day, because you've got a population level of people buying the drug and sending back data to the company. So unlike now, when you have to do research here and research there, you're getting new insights every day about when the boss asked, how's it going? You'll be able to say directly, how is it going? Well, today this happened, yesterday this happened. It's the generation of insights that have never, ever been possible.
So we've talked a little bit about retailers, both in the prior episode and in the conversation here. But so where are the retailers today on the ACNU, and what are their expectations in terms of a standardized approach or a system for these kinds of products? Because this is all new. It's going to be new for retailers too, just like it is for manufacturers. I'll start with Joe and then go to Teresa.
Yeah, the first thing retailers said to us, this is early on, we don't want 100 ACNUs. We don't want an ACNU from every company. We want a utility. We want a standard way of doing this because we can't cope with anything else, but we welcome it. We really welcome it. And I wonder how many people, I'm not going to ask, how many people in the room have forecasted an ACNU opportunity? I'm not asking the question because I do know the retailers have. That the major retailers have forecasted the opportunity that's going to come from major categories becoming non-prescription. And they've thought among themselves about the added value they can bring around this. So they're thinking very seriously about this. And they're hoping that the sponsors, the people who they get checks from every week, are doing something very big in this category.
They've been trying to surround the consumer with these conditions, with products and services for years. To be able to now use that section of the store that they've been trying to dedicate to diabetes to have the right kinds of products and the right kinds of interventions, to be able to truly help the consumer through, they have a very significant role in this, and they can't wait for it to happen.
Right, women's
and
health,
they're ready for it.
Cardiovascular issues. I mean, there can be any number of scenarios, and each one of them sort of is working on their own way of, sometimes they express it as we're getting back to our core business, which includes, in many cases, a pharmacy and a very robust OTC aisle, and that's, this is adding on to both of those. And in other cases, they still, like Walmart and others, they're still looking for what's that service model that we can offer? Like, how can we add value, basically? And it's, how this is all presented, how the information is available, what role the retailer actually may play in this uniquely.
On a continued basis, that's right.
Yeah, so like the, customer teams will also have something. I mean, not only brand marketers, but the customer teams too have sort of a whole
vested
new
interest in this.
yeah, and a whole new world to sort of map out. One thing I have heard is, well, we don't have one. We don't have an ACNU product, so I feel like I can't bring it up. And I think it can be brought up because of everything everybody's saying here, which is there's going to end up being some level of uniformity. So everyone's invited to the table to contribute in any way. That's what's nice about this. It's an open invitation. I mean, it's not settled science per se. And there will be creativity, company by company, brand by brand, et cetera, retailer by retailer. That's all going to be within bounds. FDA wants that, the key elements of the drug application to hit the mark, and after that, it's really, as long as the consumer's opting in, the creative opportunity is unlimited.
Wide open.
Yeah.
Yeah, and I'll turn to Bob for his 2 cents.
Spending a lot of my career focusing on compliance, 32 years. We spent a lot of money on compliance. You get the patient on the product, and then 2 months, 3 months, 6 months, they're off the product. I believe ACNU really is the silver bullet, and I'm really looking forward to watching healthcare costs go down and compliance take off, and being able to message those patients that are on your product on a regular basis to say, how are you doing, stay on the product, is going to be really beneficial for the healthcare community.
Yeah, just listening to the conversation, and as I've been learning more about ACNU myself, ACNU, it's really is an interesting and an exciting opportunity as I look at it from a plan sponsor perspective, an employer who's looking for alternatives and thinking about all the different products that could conceivably fit into this that even Mary Alice hasn't thought about.
Right.
That I've been thinking about.
Bring up your most favored nation antidote.
Yeah, there's so much cost shifting that goes on in the marketplace, whether it's on the consumer end of it or in the prescription and high-end specialty drug. Employers are getting much more sophisticated and looking at people like myself for ways in which they can start mitigating these costs more effectively. So like everything else in healthcare, it's built on a platform from the 1960s, which isn't going to take us to the moon. So we have to look at how we're going to change things up. So similar to what you were talking about, Joe and Teresa, the retailers are excited about this. And I think the few employers that I've talked to that actually understand this, they're very excited about this. They're going to be making these decisions, not only around coverage within a traditional plan, but also we talked about the alternative financing through the medical savings accounts as an example, or HRAs and so forth. That is going to increase because they're looking to say, how can I get the consumer, my employee, more engaged, more responsible, and I'm willing to support them. I'll help fund these programs. But they want to be able to have that opportunity to better manage what is happening with their employees. And that's a real positive for recruitment and retention, as well as productivity on the job itself.
Right, they can't just put table tents in the cafeteria about buy this OTC.
Yeah, we're beyond table
Yeah,
tents. in
no,
the
that's not going to
cafeteria.
happen.
Right.
No.
But they still do that. They still do
Yeah,
that.
I know, but this is getting back to that term which we are borrowing from another colleague, Dr. John Delfs, who's a behavioral scientist, and self-efficacy, really. That is the consumer both having the confidence and the competence to do what they have to do for themselves. And it's very empowering, and it also echoes back to what Nicholas said earlier and others have said in their presentation. I mean, that's what consumers are looking for today. They don't necessarily trust all the institutions any longer for any number of reasons that we don't need to discuss right now. But, they want to figure things out for themselves and feel that they have some modicum of control and power in this.
The brand that makes them feel smart and
Yeah.
gives them the tools and allows them to feel and see the success with the response to the information that they're given, those brands will stay with them forever. That's the kind of connections that you dream about.
Yeah, and on the reporting point, which I know when you read the rule, it sounds like, oh my gosh, this reporting is so burdensome. Actually, not really, because it's in that reporting that all of this information, it's a whole bunch of new data that we suddenly have about the actual people using the products. And yes, some of it will be reported, and every now and then there may be a misfire of some sort that has to be reported, but the mass aspect of this new information is going to be very empowering to do exactly what you're saying.
Exactly.
To know who those consumers are and build what they need.
Tailor the materials so that they can have the best success.
Yeah.
Before we close out this episode, I want to ask one other additional question around this issue of it's exciting. ACNU is exciting. So I'll start with Teresa on this one. Is it exciting to a product marketer about having this opportunity for ACNU?
Oh, it should be. I mean, we talk about wanting to have connections. I mean, we're talking about a connection that is initial, ongoing, and dynamic, and I mean, it brings it to a whole different level. So yeah, I'd be very excited as a marketer to be able to
Bob?
do that.
It brings cardiovascular disease, it brings diabetes, it brings so many, more things to the table that, currently you can't get without a prescription. And then that connection that you're going to make with the consumer and with the patient. And as I mentioned, I can't mention it enough because compliance is very, very poor. It's going to improve compliance in this country.
Well, this has been a great opportunity to do a little deeper dive and talk about how's this really going to operate and what's the promise and how this may eventually make a difference to the consumer in terms of their health, the self-care, having a better process, so to speak, that a manufacturer can go through in terms of offering a product through this new pathway that FDA has created. It's also going to give the retailers an opportunity for a different audience to sell some goods and products and probably services along with it, particularly since most of them have a pharmacist in there, and they have dietitians and other healthcare professionals that we didn't have back in the day when a lot of these rules went into place from the FDA. We've also talked about the opportunity from a marketing perspective, how that's changing some of the roles and responsibilities perhaps in some of the manufacturers of these products that could qualify for an ACNU. And then the application of technology, which we've been talking about in both of these episodes, is really enabling and allowing a lot of this to happen where we haven't had much change. So healthcare is finally catching up to the rest of the world, which is a good thing to know it's actually going to change. and hopefully we can all be part of that change. So I appreciate the panel that we had here today, and appreciate our listeners to the Only Healthcare podcast. Look forward to seeing you again on the next Only Healthcare podcast. You can check us out at theonlyhealthcarepodcast.com online. And please listen and participate in our future podcasts by giving us your thoughts and your areas of interest that we can address for future episodes. Thank you for listening. This concludes the second episode featuring our second panel from the Nicholas Hall North American Conference. And I hope you enjoyed and learned more about what this ACNU rule brings to the marketplace in the United States. We look forward to seeing you again on future episodes of the Only Healthcare podcast. Please join us and follow us by going to theonlyhealthcarepodcast.com. Thank you for joining.
Thank you for tuning in to the Only Healthcare podcast. We hope you found today's episode insightful and informative. Remember, our mission is to provide actionable and inspirational insights on how we can improve healthcare cost, care, and accessibility for all. If you enjoyed this episode, please subscribe, rate, and share with your friends and family. For more resources and updates, visit us at onlyhealthcarepodcast.com. We'd love to hear from you. Let us know what topics you'd like us to discuss in future episodes. Until next time, stay informed, and together, let's navigate the journey to better healthcare.